Ma te pehea, ma te kite, I mau ai, he rongo au e te iwi e. Kia ora mai tātou, kei te mihi kia koe mō tō whakatau, mō tō mihi kia koe I tēnei wā Devon. Kia ora koutou. That little waiata is about, it's a very old one from the north. It's about asking, basically it says, what are the answers for our people? I don't have them, so you go back out and you ask the people. And Make It Happen to Hiku is basically about that, asking the people. But before we start, just a little bit of an introduction about myself. Maunga Peko is my maunga, which is in the centre of Te Rerenga Wairua, the Cape as you might know it, and North Cape. My maunga is right in the centre, and that whole place is called Hiku Rua, which is the fin of the fish, and the area that I work in is called Te Hiku o Tika Maui, we call it Te Hiku, which is the 5 iwi up there. It's a geographical place. So there are 5 iwi in my area. I just threw a few extra slides in last minute, and these are actually for Cyrus, my work colleague down there. And we were just talking about whānau evidence. And for us as Māori, our evidence is in our whakapapa. So these are my 3 children. The girl on the left is called Hine Moana. The one in the middle is called James Ahikaro, and he suffers from middle child syndrome, just so you know. The last one is Dallas Te Haumihi. And they're the light of my life. They're everything I do this mahi for, and they are a true reflection of Te Hiku Mokopuna. And I wanted to share just a little bit of a story with you because I was one of those statistics. And my sisters always say, you know, Sher, if the children's teams were around back then, being a 16-year-old mum, having all these risk factors, you probably would have got a call. So there were 2 things I knew when they were being born. I knew that I had to give them the best start of life. I can actually turn the mic on, can't I? Is my mic on? Okay, so I can move away from you. Okay, so one was the best start in education, hence the reason why we opened a childcare centre. And I was 19, and at that stage I only had 2. And then obviously Dallas was born. My middle child, and in saying that, the other part was my grandmother always said, if you know who you are, you'll never be lost. So I knew that I had to make sure that my children had a spiritual connection to their land and their people. Not too far down the track, at 3 months old, my youngest was diagnosed with cystic fibrosis, which is a lung and pancreas disease. And I remember them saying to us at that stage, the evidence was that I'd probably would have him maybe until he was about 13. And he was diagnosed at 3 weeks old. My middle child was diagnosed at 7 with ADHD. And I learnt this word when I was 26, it's called solo mum. And I was referred to a solo mum one day, and because my kids had different daddies. And I was really, really hurt. And I was really hurt at the fact that someone labelled me, and someone actually said that the evidence showed that my children were less likely to be successful. Because I never viewed myself as a solo mother. I had whānau, and they were really engaged with their dads, their uncles, their parents, you know, like one big group thing. And my grandmother would say, you know, our whakapapa will tell us what we need to do. So I just want to show you where my daughter is. So this is where Hine's at today. Next week she turns 21. She was known as the youngest tāmoko artist across the Pacific, and that includes Hawaii. And there will be a book with her art along with other wahine. That's her. She also does whakairo. That was her first patu she made. She's a keen diver, a surf instructor. She returned home from university not long ago to work with our people in youth transitions. She has 5 horses, yet she owns no land. She just amazes me every day. And this is an example of a child fully engaged in their whakapapa, having a relationship with their taonga and fully engaged. Yeah. So what happened to her brothers? So yes, 175 of us camping below our maunga, and my sons turn up as Superman and the Little Mermaid. And my father says, we're going to walk our ancestral mountain and only your children would turn up like that. But it just shows you how they can participate and do crazy stuff inside a whānau. But I tell you where they are. I am constantly looking for them. I have been from the time they could walk. And I remember threatening them one day that I would put our pig dog collars, our GPS collars on, so I could find them. Because I'd get a phone call and say, oh, cuz, are you staying in Te Hapua tonight? And Te Hapua is an hour and a half from where our house is. And I say, no. And they say, oh, your children hopped on the bus and went back to Te Hapua? Right, so I'd have to go up north and find them. But what they did was nothing I knew. I did all those things as well. But it was the safety of, when I say, you need to tell me, you need to come home. And what my kids taught me was this. Our house is just where we sleep. That's what they say. Because our home's out there. Yeah. So this is them engaging in, obviously, again, their taonga and their whakapapa. This is me catching out moments when I've found them. Where are you? You're meant to be home. And this is my middle son, the one with ADHD. That's his grandmother, you can see with the white hair. She's 94 and has never missed a game of rugby. He went to the States for a year and played for California State in rugby, travelled to every state there was, and also played gridiron, returned home with a contract for Northland, ended up going to Auckland to play for Auckland, also played in the Blues. So the Blues under 18s and the Blues under 20s, and then he picked up an apprenticeship. And I'm a real komara when it comes to my kids, because everybody said I couldn't do it. So this is me showing you how having a relationship with your whakapapa enables you to participate in te ao. Not just in te ao Māori, in the whole world. So now I'm going to talk to you about what I came here for, and that's make it happen to Hiku. I don't know how many of you know what results-based accountability is, and what I've done is I've just put it as RBA. But basically this project is a results-based accountability and a collective impact project, and it helps us to measure where we're at in terms of our outcomes. I really love this whakatauki. Because those of you who have ever been on a waka and felt the spray on your face, and it can actually sting, I tell you what, I've felt that sting for the last 2 years. Because change is never easy, and the people you most likely think are going to support you are the ones that potentially don't. So it's a place-based, community-driven collaboration for wellbeing project, and we're actually going to start talking a little bit about who Te Hiku is. So Te Hiku, in our books as MSD, is like in units, but Te Hiku is kind of this geographical area. If you think about the population of Te Hiku, it's very small, but it's very, very spread. We have little pockets of communities that are 100% Māori to communities that are very few in Māori and are 20 minutes down the road and are completely different. Obviously we have lower household income, and one of the things that we have lots of employment in is in health and social services. That's second to our forestry. 33% of households in Kaitaia are sole parent. Isn't that interesting? Yeah, so you times my whānau by heaps, The dependency on benefit is very apparent when working into Hiku. Employment, we have a lot of employment schemes, but we're unable to sustain them. And our access to technology is just, at lunchtime, if you're working remotely in Kaitaia, everything drops off. Everybody's trying to use their phones. So doing surveys online are not necessarily the best thing to do in Kaitaia. So this is a real significant moment for us. This is where 4 out of our 5 iwi signed a social accord, but more so than that, they are settled iwi. So we are now in post-settlement mode into Hiku, bar 1 iwi. So that becomes a real game changer as assets and resource and transferring of those assets start to take place, because it creates different opportunities. So the Accord sets out some real clear structures for iwi to engage with the Crown. Once a year, there's 13 government agencies inside this Accord. Once a year, the iwi chairs meet with ministers. Twice a year, the Development Trust for Te Hiku meet with our chief executives across those ministries. And we also have a secretariat at a regional level. So all the regional managers of those agencies work with us, and we develop like kaupapa clusters. And yeah, it's a cornerstone, and it is affecting positive change. So post the signing of that Te Hiku Accord, we had Minister Bennett, at that time was the Minister of Social Development, and we had some real significant events taking place in Te Hiku. So we had some real big stuff around sexual abuse, particularly for children. We had some murders. We seemed to be in the spotlight big time, and there was a call from Minister Bennett on how do we actually engage the community to be a part of this, but also something complementary that allows those moving parts, whether it be iwi, government, local government and community, to start moving together. So she came up north and she met with our iwi chairs. She also met with community leaders. She also met with the NGO sector, and she asked if she could put this complementary project together on the ground with them, and that became Make It Happen Te Hiku, and she launched it. So this was quite a really big thing around, this is interesting because she says, I'll give you the power of my office and happily and humbly hand it over to you. Look beyond what it is now, and the way it has always been doesn't have to be how it is, eh? So that was really big. There are about 200 plus people in the room that heard that kōrero. She wanted to know what was working, what wasn't. And for me, who was sitting up on the stage, and she said, now everybody call Sheridan around here. And right at that moment, I had this epiphany. I can't do this on my own. And I just remember someone saying to me how shocked I looked. So I got up and took the mic off her and asked everybody in the hall if they could help, and I needed volunteers, and I needed volunteers fast. No one was jumping out of their seats, so I started to call them out by name. And then I was pointing to where they were going and, watching them get up and walk and sign themselves up. Yeah. So we signed up roughly over 50 volunteers that day from all walks of life, from many, many parts of Te Hiku. So part of our response was obviously launching the project. What we did was we put a project action group in place to oversee this development. And the project action group consisted of NGO leaders in the community that were engaged with our whānau. Now, they played an advisory role. And we were kind of in a rock and a hard place, because you need to engage that sector, because that's the sector that's going to have to do a lot of change. But also, it's the very sector that is quite vulnerable when decisions are made. And so you could see on their faces, we've been competing for so long, and now all of a sudden you want us to work together and you're going to tell us where the funding is? Hello. you know, and you're going to let our community tell us, oh, yeah, right. So that was a really interesting process, and it took a lot of relationship management to continue to get them at the table, but we pulled it off and we did. And they were a part of overseeing the development of the surveys. So we developed these surveys. We designed one for children in school. We did youth ones. We did all the community ones. We did NGO surveys, all following the same RBA questions and a bit more. And we did agencies. The NGOs and the agencies really didn't respond, but the community did. We introduced this RBA thinking, not just to the project action group, but to the community. So we ran a lot of training on it across the community, and that included our volunteers because they needed to be up to speed with it as they asked these questions. And they were running little cottage meetings, and what we did is we set up like a, in the units, we found out where each volunteer lived, and we made sure that we helped them to do that geographical area. So we then started, through the community visions and surveys, we started to design the community outcomes and indicators, and we had to validate those back out into the community to get sign-off before we could actually get this report. What we did was population turn the curve exercises, and I don't know if you guys are familiar with them, but I can show you some more through our slides. And we drafted the Make It Happen to Hiku report. And I have brought some with me if those of you are interested. And I just want to acknowledge my colleague here, Jack, who actually pulled the report together. And yeah, awesome, Jack. Really challenged us. And then we launched it. All right, so we did training, facilitating, did some more facilitating. We did this all within 6 months. 2.5 months is what it took to get from the project action group to validate our outcomes. So the space that we were actually working in was the ends. What did it look like for our people? What did they want to see at the end? We didn't discuss what performance looks like. We just were looking for some really good indicators to know if what we were doing was the best for our people. We got into the means a little bit later. We'll talk about that. So this is our collective impact platform with RBA. So one of the things we pulled off was it was community owned in terms of the populations, and we had a clear common agenda. Through our workshops with our community, iwi, through designing our report, our actions and activities, that's where we got the mutually agreed reinforced activities. We also got our 5 outcomes and our 10 indicators and started to develop some mapping tools. So post the launch of the report, and we'll talk about this, once the report was in place, we had to set up a community governance, and that became known as the task force, and they were all ministerially appointed to oversee our implementation plan. And then the Ministry of Social Development continued to enable the work plan by supporting the backbone organisation. So here are some of our volunteers with Minister Bennett. No muck around aunties, we call them. So we went everywhere for the engagement, workplaces, marae, kohanga, had coffee groups, schools. This is where our volunteers, wherever it suited our people, that's where they went. And this is what we got back. We engaged over 2,000 people, but the reality is we got 1,250 actual return surveys. And what we did was, because we had SurveyMonkey online, but then we plugged everything we could from SurveyMonkey, from every hard copy survey we got back, we put it all into SurveyMonkey. So we were able to really view the data and pull it together and start to shape the community outcomes. As you can see, where they were living, was really big. Hang on. Oh, hang on. Sorry. Click, click, click. What we got back though, just in saying that, was 73% of the respondents were Māori, which is really quite big. 50% were rural and 50% were urban, urban being like in the Kaitaia kind of area. Sorry, I've got my back to you all. And what we did was we pulled these multiple partners together needed to do the work. So those are the workshop sessions that you can see in those photos, is the volunteers, community members, and our really big one, which was iwi, government agencies from Wellington through to the region, community members, you name it. It was all mixed up all in one room and having to work together to harvest strategy ideas. So basically here are our outcomes. These are the outcomes that our community wanted to see, and like I said, we validated them. They also chose the indicators. And that was a really big one, because what they wanted to see recorded and what we had access to were two different things. So it had to have data reach. It had to be something we had to collect often. But remember, these are population, so we haven't drilled into the performance yet. So under peaceful, safe and connected, just as an example, you have the outcome, and then it's described as we treat each other with respect and dignity. We look out for each other by having zero tolerance to all forms of violence and abuse. We have safe public places, roads and facilities that are usually user-friendly and acceptable to standards. Our public places are welcoming environments for families and groups to meet and connect with each other. We prioritise protecting and nurturing those in need in most in our community, and we have families and friends that celebrate together and spend quality time together. So this is what it looks like for Te Hiku. This is how they've described themselves in their future. So this is the launch, which we had about 600 plus people attend from all across the community, and the report was handed over to Minister Bennett and Minister English. And it was accepted, and then from there we had to put together a task force, which I said to you before was ministerial appointed to get that grunt to keep plugging and pushing through on the action plan, and we launched our report. So the 27th of June was the task force, and their tasks actually starts here. And what they've done is they've looked at the community report, and we've developed some programs of work, and I can touch base on those with you. But I just want to talk about the highlights of Make It Happen Te Hiku. So the highlights are the 5 outcomes for us. They've created a magnet and the indicators, how we're going to measure how well we're doing. This is something we've never had in our community. We've never been able to share have shared outcomes. We all have different drivers. So what we've done is we've established what we call collective impact groups that hold us to account on specific initiatives that help us to keep working collaboratively together. And what we use is the outcome and the indicator as our guide. The training of staff was big. Just the amount of community buzz and leadership around the place. Anybody can do anything as long as it's from the community and it has a line of sight to your outcomes. The biggest thing for me was understanding all the different drivers, and how us as government often, well, we all know that we've created a competitive environment, so when you're trying to detangle something like that's going to take time. So moving from the ends to the means of what's working, we've had significant amounts of co-investment, and I'll use the example of Healthy Families RFP or EOI went out not long ago, and our healthy and well outcome and indicators, and using the evidence from Make It Happen and the iwi Wellbeing report helped land our iwi to be the lead provider for healthy families in the Far North TLA area. So having this report has helped us to herd those significant initiatives into our space. We also have developed from our prosperous and progressive outcome, we have the ECE indicator. We have delivered a scope and on our ECE sector, we've delivered a strategy with an action plan, and we are full-blown into implementation, which means we're going to have a hub that allows us to connect punareo and kohanga, bilingual and mainstream, into one point so we can support them in terms of their professional development. One of the things our people wanted was quality education. So that's a real, for us, that's a really good example from the ends and the means into action. We have a communication for social change plan. That's exciting. Basically herding all the social change initiatives and using it in a different way to get the results that the community is seeking. And that's going to be a different way that we evaluate. But basically, here's our political setting. Here's Make It Happen to Hiku, and it's based on Te Tiriti o Waitangi. So the social accord is the blue part. That's the iwi. We got the Crown, and then there's us as the community. We're all stakeholders there in the treaty. The Hiku Development Trust is part of that mechanism for iwi, and the Make It Happen Task Force is the mechanism for the community. Here we go. Our project action, our Make It Happen backbone organisation or program team has a real relationship with the Social Accord Secretariat, and that's where we share our collective impact spaces into initiatives. Where you see the overlaps in terms of the outcomes, that's where you would say those are shared interest places. So that's where you need to get to, is identifying the common agenda inside those spaces. But at the end of the day, it's the ministry that purchases the services, eh? So we have to know as government agencies that we're working towards our drivers, but also we've got to take into account that the magnet for this community is going to be our outcomes. And we report of line of sight. So the beauty of using RBA for us has been that MB, MSD and a number of other departments, education, are using results-based accountability too. So it's been easier to form a common language when engaging and we're reporting out. So here's our collective impact space, and this is where it takes place on the ground. This is the operational leadership inside our clusters. Here's our outcomes. And here are the collaborative groups that exist in our space around our providers, our NGO sector. I know it's a very, very busy slide. Very colourful. There's our delivery framework and obviously our delivery settings. So bottom line is the outcomes and the indicators are the magnet, and we're all working towards that. To be fair, MSD hasn't completely funded the whole of the backbone organisation. We've had funding put in for resource from Far North District Council, from Te Puni Kōkiri. We also, we're sharing it. If we agree on it, we're sharing it and we co-invest. As a task force, my task force have had letters from iwi seeking co-investment and quite happy to put 175k on the table as long as you can find another partner to fund some research. So that's how significant it is up north. The iwi actually signed off the community report, and one of the reasons for that was that we had no task force at that time that the report was finished, and we asked the community, who do you think should sign off this report on your behalf? And basically they said the iwi, because if there's anyone that has the political leverage that can support us if anything goes down, we'll be counting on them. So that's what happened. 5 out of the 4 signed it. So I'm just going to introduce this DVD, and it's just a message to you all.
If I have one message to give to the Crown, it'll have to be to maintain that aroha of our tupuna that accepted whoever came to our country to find a home, a peaceful place for them to live and bring up their families. Mokopuna means a lot to us. Every generation has a mokopuna to carry on. And this is why I believe that we are here today, because we are gathering hope for our mokopuna, to tell the government that rather than finding legislation to stop our tribe of Ngāti from developing their land, even walking on the land, even the legislation of the foreshore seabed, it is really a very, for us, it's depriving what was given to us free by the Creator for our survival. I'm talking about Ngāti Kuri and all the hapus right throughout the country, for all the mokopunas in the country. We shouldn't be legislated out of the survival what was given to us by the Creator. My identity. What will become of me if my rivals claim the victory? Laws with claws like parasites, devouring my human rights. Anyway, who wants authority and eternal conflict? I'll regain my own identity, though I'm landless in my own country. The open skies and glimmering seas are still mine, and they're all free. Free, free. Kaki te wai kamaringi huri ana te moana te haerenga te wai rua. We the Māori didn't need a treaty. We owned the country, everything in it, above and below the water, above and below the mountains. Everything is Tonga, belonged to Māori, to Tupuna Māori.
So that was my grandmother. Can you imagine what I grew up with? But why it is important to us is that it's about all mokopuna, and that's not just Māori mokopuna, that's all mokopuna. So we just wanted to make it clear that Make It Happen to Hiku is about all. We're just very blessed that we have iwi in the position that they are now to enable our communities, their whānau and their hapu. So I think my time is just about to an end. So that's just acknowledging those that set the platform and who were all involved. And yeah, I think that's about me. Are there any questions? Everyone's rather quiet. Oh, there is a question out there. Got a question for
question. It's just, how do we get hold? You had some really interesting slides. How do you? Can we have a copy of some of those slides? Because it's a lot of thinking to do, and it was tremendous. Thank you.
Of course, you can all have copies of the slides. I just acknowledge that it's shoving 2 years into one presentation, so it is a bit to take on.
I'm wondering how the kids are tuning.
Ah, so are we. So we're in the process with our analysts being on board of actually revisiting that and the strategies that we have. So we hope to, within the next 6 months, have our A3 dashboards all set to go in terms of reporting back. We annually have to report back to our community, so yeah.
I'm wondering if you could just explain more about the startup, because basically the program was driven by the government and it was their idea, and then you had to turn that around and get the community engaged in that, and often that doesn't sit well with people to be driven by Wellington for something that's for themselves.
Yeah, that was a really challenging piece of work. So really, it took a lot of relationship management. I mean, to be fair, engaging the volunteers is what enabled our community to own it, as opposed to it being government driven. Okay, so and lots of cups of teas and going around and visiting leaders that, you know, I grew up there, so I just go and tell them that they need to step up. I totally get that, what you're asking. But I don't recall another community that's been given an opportunity of a blank sheet and been able to redesign. So, I think that was... And the fact that they knew that the ministry wasn't going to own it at the end of the day. Yeah, that's what helped. Getting champions on board.
When you talk about your results, who is going to be the most important feedback mechanism, feedback people to you, your community or government, or how will you actually manage to get feedback from a government department when it's not normally the practice of government departments to provide the slightest bit of feedback to the information that community organisations give them?
So a couple of things. The report back comes from our task force. The task force have Better Public Services as part of its work plan and have the opportunity to engage directly with the minister and other ministers on that. And they will front a lot of the feedback to the community. They already front a lot of tension. And it's really flipped. What's flipped is that rather than an NGO pick up the phone and ring a minister or a CE, more often than not they'll come to the task force first and have that conversation first before doing that. The beauty of having a complementary project to the Te Hiku iwi is that the iwi are allowed to ask those questions and tend to do get that information because of their high level partnership. They have an awesome report.